Welcome back to Living Local. Vera Community Mental Health Center has expanded to help provide more resources in the QCA by adding a full-service outpatient clinic in Bettendorf. Now, they're upgrading their Central Park clinic in Davenport. And joining us in studio to tell us what these renovations mean for our community is Dr. Rich Whitaker, CEO of Vera Community Mental Health Center, which is also this segment's sponsor. Dr. Rich, so great to see you again.
Yeah, you too. Thanks, Brandy.
Okay, so you're about to start on renovations at the Central Park Clinic, like I just mentioned, but what exactly needs to be renovated, and what are maybe some of the problems with the building right now?
Well, you know, the building's great. It was designed by Dr. Vera French originally, and, and it was built back in 1970. And you know, back in the 70s, I don't think people were concerned as much with those who might have some difficulties walking, getting upstairs, that kind of thing. And you know, we've had that issue ever since it was built. There's these big steps right in the front of the building, and that's the only way to get in the front door. And so that's all going to be changed. Our waiting rooms are too small. We can only accommodate maybe 20 people coming into the building or being there in the waiting area. We need to get to more like 50. So we're really trying to change the whole way the building works for people coming to get services at Vera French.
Yeah, that's so important, so important. So tell us a little bit more about some of the renovations that are coming then to this clinic.
You bet. We're essentially putting a whole new front end on the building. We're changing the way that front end works so that people can come in at the parking lot level and go up either the stairs or the ramp, but inside. That'll all be inside the vestibule. And then once they get in, they'll have a clear view to exactly where the front desk is. They're also going to be able to have intake persons right up front there, so they don't have to go clear down the hallway to talk to somebody from intake. And there will also be the MA offices right up front. It's just going to be all more open, more windows, it'll be more lighting, it'll just be a better experience for everybody coming in to get services at Vera French.
It is beautiful, and we have pictures up on the screen right now, and you can tell the stairs are gone. So it's going to be much easier, as we can see, getting into the building, right? And it's just beautiful. It's a beautiful building. Or it will be when you're finished.
And you know, the ramp inside is going to let people go up who have a walker or a wheelchair. And it's an easy ramp. It'll be so easy and get right in with sliding doors. No more push button. It just recognizes you're there and opens up. And then coming in, you'll know exactly where to go. You'll see the front desk there, and there'll be lots of seating options so that people don't feel like they're crowded or they're on top of one another. So just really an open, spacious waiting area that will allow us to serve more people.
Yeah, definitely. So where are the funds coming from to pay for these additions and improvements?
Great questions, because you know, Vera French is not loaded or anything like that. So actually, this is from the federal government. So we applied for a grant last year, and we're able to get that through our Congresswoman Marionette Miller Meeks, and we're excited that that's come through, and that's paying for all or nearly all of everything we're doing with the building renovations. So
now if the whole front entrance and the waiting room will be changing, will services be interrupted at all?
So during construction, it is going to be a little bit different. We're going to have people come through the back of the building. We'll actually move all of our front desk operations and our intake and medical assistants who do vital signs and all that. That'll all be moved to the back of the building. So there'll be a real clear way to get help and services. But none of the clinician offices are going to change. So people will still go to where they've typically gone to get services. Same person, all of that. The pharmacy is going to stay in the same place. A little different you know, directional arrows and that kind of thing for traffic flow through the building. But this is only temporary. This is for just about 4 or 5 months while we're getting everything done. And we should be done by the end of the year. So within 2024, we'll have this all completed.
Good to hear, good to hear. What about the parking? Is that going to be an issue at all?
Well, during the construction, everyone will be parking in the back of the building. We do have parking back there. And we'll ask staff to kind of move elsewhere so that they make plenty of room for those coming to get services. But yeah, that might be a little bit of an issue. But you know what? We're going to make sure that this is a good experience so that nobody feels like, oh, gee, I don't want to go to Vera French during construction. No, come on. We're going to make this special for you.
And I'm sure there'll be signage and everything else for folks to know which direction to go and that you're still open and still have those great services as well. Do you plan a groundbreaking ceremony at all?
We do, yeah. April 19th is our groundbreaking. It's ceremonial because we're not actually going to be cutting in right then, but yeah, April 19th at 9 a.m.
Okay.
And we'll have the congresswomen there. We'll have some dignitaries. It'll be a really special event. Everyone's welcome to come. Big tent out in the front of the building. Yeah,
awesome.
It should be fun.
Awesome. We have all the details right there on the screen. Dr. Rich, thanks so much for taking the time to come in and talk to us today.
Thank you.
All right. Again, this segment was sponsored by Vera French Community Mental Health Center. And for more information, you can go to verafrenchmhc.org. We'll also have all those details posted on ourquadcities.com. More living